Hello, Namaste. This is Dr. Satyendra Katewa. I'm a pediatric hemato-oncologist and a bone marrow transplant physician, and I work for SHALBY Sanar International Hospital, Gurugram, Delhi NCR region. Friends, today I want to talk about thalassemia and its curative potential. What are the therapeutic options available? So, thalassemia is a genetic disease in which there is a problem at the level of the stem cells, and because of that all the red blood cells which have hemoglobin inside them are formed defective. So body is making red blood cells, but those red blood cells can't get out of the bone marrow. Bone marrow is the space inside the bones. So red blood cells are being formed there, but they are defective, so they cannot get out of the bone marrow. They are formed, they are destructed, they are formed, they are destructed. So that means the bone is working, bone marrow is working, but effectively we do not get the hemoglobin because those red cells are not coming out in the veins or even into the blood, peripheral blood. Now, once you do not have hemoglobin, your brain senses that hemoglobin is less, and that tells your bones to make more. So your already working marrow produce more, but that doesn't help because it's whatever you are making is destroyed inside the bone marrow. We call it ineffective erythropoiesis. So that's what thalassemia is there. And because constantly there is less hemoglobin, the liver starts swelling up, the spleen becomes higher, and then only way you survive is by taking blood transfusion. Now in blood transfusion, please remember, if you are giving 100 ml of blood to the patient, 100 milligram of iron goes inside that patient. That iron then goes to liver, to the heart, to the rest of the body organs, the genitals, and then they do the damage there. Now, how do we cure? The only way possible is an allogenic bone marrow transplant. Allogenic bone marrow transplant means if your patient has got thalassemia, then you do HLA typing of the patient and all the brother and sister available. If any of your brother and sister is a thalassemia minor, no problem, you can be a donor for thalassemia minor. And if there is no brother or sister which is matching 100%, then we can search for a donor in the international registries, and if there is no donor, then we can even do a 50% match from either your sibling or the parent, and which we call it a haploidentical bone marrow transplant. So thalassemia, you can get out of the thalassemia, you can be cured, but the most important thing in thalassemia transplant is please get it done as soon as possible after 2 years. First 2 years we don't do transplant because the brain is still growing, and in bone marrow transplant we have to use chemotherapy. After 2 years, early you get it done, better is the outcome, whether it's 100% match unrelated donor transplant or haploidentical. So the only decision you have to make is get it done and get it done early. Second part, whatever blood transfusion you are giving to your patient, please use a white cell filter. Ask your thalassemia units, your doctors to arrange that. And then as and when you are ready for bone marrow transplant, come to us, we will help you. I hope this solves your almost each and every question and get you ready for the transplant. Have a great day. Thank you.